Well, hello there, class, and here we are, end of the first week of Unit 5. Yeah, thanks for continuing just to kind of keep going. I mean, that's the thing. You're keeping at it. So life is crazy and busy. It's been fun to engage in conversation with a number of you, just kind of hear about life things that are going on, both the good and the bad. And I appreciate the fact that you're even willing to share those things and to engage. I love to get to know what's going on in the lives of my students. I know you have a lot going on. So thanks for what you're bringing to the conversation, to the table. Just your commitment to learning and all that. It's fun to teach elsewhere this term, have multiple schools going on, but I'll tell you, it always makes me very grateful for the opportunity that I have to continue to work with MFT programs at APU. So y'all have a real special place in my heart. I think you bring some very special conversation pieces to the discussion, and I love that you're able to kind of dabble in some different areas that you wouldn't normally be getting into. So so it's a real fun experience, and I hope the same can be said for you as well. So I wanted to do a couple of different things. I want to do one video today, and then I'm going to do another video probably on Monday of next week. And I want to talk with you just about some questions that you had. So I'm going to actually go back to Unit 4 because I didn't get a chance to get a video out on those questions. And then next week I will respond to the questions that you're asking about this week's reading in LibTac for Unit 5, and we'll respond, like I said, next week. And then, believe it or not, we are going to be done with Unit 5 and only have 3 more left, 6, 7, and 8. That's crazy to think about. It's bonkers to me that by the end of this week we will have only 5 weeks left, I believe is what it works out to be, something like that. It's insane. 5 or 6 weeks. So thanks again for what you bring to the table. So here's a great question. I really love this one. I'm going to read it exactly, so my eyes are going to divert over to this other screen so I can look at it, but also have this screen from the recording up as well. It says this: in Chapter 3, LibTac started out that career counselors do not have resources such as the DSM-4 to guide them. This is older, of course, that's what they're referring to, on the diagnosis of their clients. Hence, they need to rely on the existing theories of career development as a framework of diagnosis. Great, good. However, he also pointed out that these theories are limited, and they're continuing to have more and more, but yes, there is some truth to that, absolutely. Hence, the counselor must, and they put in quotes from page 20, learn to pick and choose the best techniques from the various theories for the appropriate interventions. Therefore, my question is this: how do we determine which techniques to pick and choose from if the current theories are not comprehensive enough in the first place, and what must we do to ensure that we are not doing a disservice to them by applying these limited techniques? What a great question. So thank you for the individual that asked this question. That's really, really great. Just insightful and it's thoughtful. And I would say this: there are limited theories and techniques. It's a growing body of research and literature, for sure, and we're grateful for that. But it doesn't have the long-standing history as some other counseling-related areas do, such as marriage and family therapy. So, I'm not quite sure on when we would say was the starting point of career counseling. If you think about it, there's no licensure or certifying body or credential or anything of that nature that you're required to have to be a career counselor. So there are a number of bodies out there. There's the Center for Credentialing and Education out of Greensboro, North Carolina, and they grant a Global Career Development Facilitator designation. You can also become a board-certified coach, and you can have your specific emphasis be in career coaching. You can be International Coach Federation certified coach, and I don't know that they necessarily have a focus specifically on career coaching, but you can do that as well from a coaching standpoint. And then there's the National Career Development Association, which there was some content that was shared earlier in the semester on that organization. And they grant a number of different credentials, one of which I have, which is Certified Master of Career Services. So there is a growing body, right? In addition to the research and the literature, there's a growing body of designations or credentials that are going to quote-unquote qualify or deem an individual to be qualified. There are some very limited number of academic graduate level programs that train career counselors, But because of that reality, there isn't any one kind of official, firmed up approach to career counseling that everybody has to adhere to in order to be in line with certain standards. I mean, there's ethical standards and all that, but it's a very different process that we're talking about, from marriage and family therapy, counseling psychology, LPCC, all those different things. That said, one of the great benefits of having this course specifically in the MFT program is you're able to pull from and call upon and utilize your previous training and experience to really, I think, kind of shore up some skills, to broaden your perspectives, and to, I think, really elaborately kind of aid you in this career counseling process. So there's a lot of processes, or I would say processes involved in counseling, as I'm sure you are learning about. There's group process, there's systems thinking, there's all of these different approaches. And there, you talk about the importance of asking good questions and being well informed and knowing, where to send people, and how to listen well. All of those different dynamics are at play, and those are similar whether you're talking about a marriage and a family or a personal issue, or you're talking about a career issue. So what do you do then when you have a client come to you and they're faced with an issue, and you know that there's a limited body from which to work? Well, I would say similar in some respects to your work as a counselor, as a therapist, is you become really well versed in not everything, but in a few different approaches. Okay, so maybe your expertise is career-related personality assessment work or something like that, or interventions, or maybe you are certified in a couple of different bodies that do present opportunities to think from a holistic career standpoint. So maybe it's Myers-Briggs type indicator, maybe it's the strong interest inventory. These are kind of the go-to assessments. Maybe it's the strengths finder. Maybe it's, as we talked about even earlier in this class, is the the well-being index. There's a number of different assessments, but there's also a number of different theories, right? We look at Savickas and just all of the different resources that we've explored so far in both the theoretical framework standpoint and the technical, right? The techniques and the theories, right? So theory informs practice, practice informs theory, and so forth. Really important takes for us to have when it comes to doing this work. But you don't need to know and become an expert in everything, much like, you're not going to become an expert in marriage and family therapy. But you are going to kind of have this area of expertise. Maybe it's CBT, right? So cognitive behavioral. Maybe that's what you really want to focus in. Or maybe your specialty is narrative therapy. Well, you can use elements of that, especially in narrative therapy, when it comes to career. So, and it's just, going to be referred to by kind of different names. I want to show you a book that you may want to consider using. It's called Motivational Career Counseling and Coaching. So it's a British text, Cognitive and Behavioral Approaches, but it actually shows some pretty clear connections to cognitive behavioral therapy that you may want to consider looking at. I'll put this in the video as well at the bottom in the liner notes, but something to consider. So as you're reading through the body, what Tang's talking about, you're going to learn a little bit about a broad kind of swath of content. You're not expected to know everything or be an expert in everything. But what I'm hoping for, what we're hoping for in this class, what the expectation is that you learn a little bit, kind of the tip of the iceberg, and you go, okay, so that's great. I know it now, and maybe you never use it. Maybe you put it on the shelf, and that's okay. Or maybe you learn something, and you're like, man, that's actually sounds like it would be really up my alley. I think I might want to explore that more. So you go a little bit deeper, right? So you don't just get the books that are assigned for this class, but you dig a little bit deeper and you get into some of these areas that you've read so far in the class, and you have an expertise being in those areas. A lot of the work that I'm doing is it's going to be more based in coaching than it will be in the counseling aspect. So I'm not using as much of the theoretical framework as I do kind of a coaching framework to coach or to coax information out of clients. I don't mean that in a manipulative way. I mean that in the information's in you. You just need somebody to ask proper and appropriate questions to get it out of you. And that's the approach that I'm attempting to take as I do this work. So I know I'm kind of a roundabout response, but I think that what I would encourage you to do is hone in. If this is an area where you want to spend some time from a working standpoint, hone in on the things that you find really valuable. There was an approach that was looked at and taken several years ago in a different book that I used to use, and it was the communicatarian approach. And is that right? I think that's how you said it. And basically it was looking at what is the role that career counselors have to play within socioeconomic demographic, from kind of the least or underserved populations. What do we play? What role do we play in the communitarian approach? What role do we play in helping to shape policy, even thinking how can I use the opportunities, the position, and really in some ways the power that I have to help provide opportunities for those that are not always going to be as well or properly served, right? More of a marginalized community and so forth. I think that's a great approach. So some people go, that's what I want to focus on. I want to hone in on that. Or maybe you I really like I was looking at a poster in a wall here in my office earlier, and it said, if there's not door, if there's not, if it's a closed door, if there's no door, then build a door, right? This planned happenstance approach. So sometimes in order to walk through a door, you actually have to build the door. I think so often, especially I would offer up in Christian circles, we have language like that says, well, the door was closed. Or, we'll say things like when God closes one door, he opens a window. And I don't know that's sound theology. I don't know that's actually how God operates. In fact, I would argue that it's not. Because I think sometimes I might look at a closed door, but my question then is going to be, well, did you try the handle? Did you wiggle it? What did you try and open it? Did you pound it down? Did you get an axe or you saw a wall and it seemed blank? Well, did you even think to build a door to get through? And I think that's a really important approach to take. This is a challenging question because there isn't necessarily a one-size-fits-all approach, nor is there in marriage and family therapy, right? Nor is there in counseling psychology. But there are some actual designations. There's some frameworks that you have to adhere to, right? The BBS is in some ways in California regulating how you do this work. Whereas in the career space, you might have it at the elementary school, it might be at high school, it's going to be for sure in college at the graduate level. You'll have private practitioners like myself. You'll have people that are teaching content like I am, and everyone has a bit of a different take, and so there's always going to be a different approach. But I would encourage you as you think about, okay, what is it that I want to be known for? What approach do I want to take? And then get really good at that one approach. Not trying to, be a master of none, what jack of all trades, master of none, but figuring out what's the thing or the things, maybe it's 1 or 2, 3 areas of expertise that you want to bring to the table. So it's a great question. It's much more involved. If we had all sorts of time, we'd probably even take a full, class session to discuss all the different approaches and interventions and different theoretical frameworks we could use. But that's just kind of a real surface level answer to that question. But there's so much more to get at with that. So thanks for that question. Another question says, meaningful closure to a counseling relationship is often a most difficult task for counselors. I'm going to answer this very quickly. Counselors and clients resist closure, page 23. And then it says this, and I love this. I was kind of bummed they didn't go more into the why. I understand why for a client, but why would a therapist resist closure? That's a great question. And I would say, I don't know. Because for me, when I'm working in the situation with a client, I always want to bring about closure. I always want to, first of all, I want to leave it so that the client feels that they have actually had their needs fully met, right? So, and then I'm always going to ask the question, do you want to do anything else? So here's my approach. I require clients to meet with me 4 times, okay? And we go through a step-by-step process. If it's what's up, what's so, what's possible, let's go. And I say, if you want to accomplish what I think you need to accomplish, it's going to take at minimum 4 meetings, okay? After that, it's entirely up to you. I'm not going to push or prod or encourage. I'm going to leave it up to you. And if I feel that we've gotten closure, then great. For me, I have an approach already from the beginning that says we're going to close this thing up by giving you lots of options to explore at the end of the 4 weeks or the 4 meetings. If you want to continue on, we're good. But then we've got to revisit what does closure look like. So I don't know why somebody would resist, especially on the therapist or the counselor side. I can understand on the client side, like you said, but on the therapist side, I never want to resist closure, and I hope that none of you will either. So great question. I'll come back next week and answer some more. Thanks so much for your questions, and I'm looking forward to continuing to see you online.